Hi, it's Christine doing an update on some doctor appointments I went to last week. And before I get started, Dr. Diana asked me what my diagnoses were, and I couldn't quite figure out how to respond. She doesn't, well, I can't copy and paste them. There's too many to list, so I thought I'd run through it really quick because I wasn't sure if you guys ever really knew. When I went to the National Institute of Health, this is the rundown of the 10 diagnoses they gave me. So the first one is atypical asymmetrical progressive spinal cord syndrome of an unknown etiology with progressive quadriplegia. Okay, atypical asymmetrical means that it's different on each side. And obviously a progressive spinal cord syndrome, you know, they can't say it's MS and they don't know what it is. But number 2, atypical asymmetrical retinitis pigmentosa. Now I think I told you guys that I'm blind in my left eye, and I was diagnosed when I was 17. So that's where the atypical asymmetrical comes in. Okay, number 3, chronic debilitating muscle spasms. Okay, that's why I get Botox treatments, or why I did. I'll go into that a little bit more with my doctor appointment. Number 4, mild respiratory compromise felt to be secondary to neuromuscular disease, with the last pulmonary function test at 50%. Okay, well that's changed, so I'll have to touch base on that. Number 5, spinal cord atrophy, stable. Okay, if anybody doesn't know what atrophy it means, it's basically my spinal cord is shrinking. Number 6, neurogenic bowel. Number 7, neurogenic bladder, which kind of goes along with MS. A lot of people have those same problems. Number 8, significant family history for multiple medical problems, including bowel mobility symptoms, cardiac, psychiatric, connective tissue disorders, vision, and seizure disorders. Okay, I guess that's what's throwing them off, is because there's so many different stuff running in my family. Number 9, okay, and this is the kicker, right? Abnormal brain magnetic resonance imaging, brain MRI, with mild atrophy. So that means my brain is shrinking, and metal deposition in symmetrical pattern of the basal ganglia and midbrain and dentate nuclei, or whatever that means. Okay, so basically that means I have metal in my brain. Well, maybe that's because my left jugular doesn't work. And so who else can explain why you have metal in your brain? That's it's iron. Okay, number 10, well, basically they're just researching my my spinal fluid, and that's pending. Okay, Dr. Diana, to run down the diagnoses, that's where it was December 2011. And today I just had a couple big appointments. I mean this week, excuse me. And there's some good news. Well, first of all, the Botox. A year ago, I was getting about 450 cc's of Botox injected in my back, my hips, my legs, my buttocks, my arm, mainly just because my muscles are hard as rocks. If you ever had an EMG test, they hook little microphones up to your skin, and they inject a needle into your muscle, and if the muscle's relaxed, it's just quiet. But if it's, you know, flexed or moving, it makes it sound like total static. So that's how you explain that. But the good news is it took a long time for the Botox to work for me. I'd say about 9-10 months, maybe, because he started me out slow. Then finally, April of last year, I went 12 weeks with no muscle spasm. So that was great. And then every 12 weeks, I go in for injections. And then this last September, my breathing pulmonary function test dropped from 50% to 38%, which is a huge progression. They call that, the doctor told me that I have a life-threatening condition at this point because my breathing lung capacity is so restricted because of muscle squeezing. So anyway, I went in for my more of a detailed pulmonary function test, and I scored a 41 instead of a 38 this time. And 3 points difference is basically the same. 5 points would be better or worse. But when I talked to my doctor, he told me that people with breathing lung capacities like me, people with neuromuscular diseases, he said, always get worse. He goes, we don't know what you have, but for you to stay the same or maybe even make a slight improvement is basically not what he sees. He said he was expecting me to get worse. So I didn't realize that that was the case because, of course, I've been under tremendous stress over the winter months. And so that has gotten better, and just recently I've been feeling better. I actually got some help with Adult Protective Services to straighten out some of the stress I've been undergoing. But the last thing that I wanted to talk about with my doctor's appointments is later this month I'm seeing a GI doctor because I'm having continued bowel mobility problems, and basically my abdomen is distended, which means I feel like I'm pregnant. It's like it's hard. It's not like squishy wet fat, So because my stomach was so hard, I thought it was my diaphragm. I asked my doctor, I go, is this my diaphragm? Because it's just hard as a rock right there underneath my ribs. And he goes, no, that's your ab muscles. And I'm like, really? So I have a six-pack? And he goes, yeah, you have a six-pack. So I guess maybe if I lose a little bit of this fat, I'll be having a six-pack. But he told me actually that I had some healthy weight gain, and he'd like to not see me as so skinny as I used to be. But anyway, overall, the doctor with the Botox, the last 12 weeks ago, he cut my dose in half. So instead of 450 cc's, he gave me 200 cc's, because when he's going into those muscles in my back, they're not making the static sound that they were, which is kind of unknown because Botox wears off. It's not like it fixes you or whatever. But by the grace of God, I have been free of those debilitating spasms for quite some time. And this last time he actually went down to 100 cc's, which is like practically nothing. Put in a couple injections in my back, and I was unable to stretch my arm out straight. And now I can stretch it out straight because he went into my bicep muscle, and that was cool because I got to see it because I'm always on my back, so it doesn't hurt really, but the needle is pretty darn long and it's really flexible, but it fixed it. I can straighten my arm. My arms are wanting to stay bent because of, sitting in the wheelchair. And then the third thing that was pretty cool at that doctor appointment was that I told him I still could bear weight and that I haven't really, been in the gym for myself. It's always been for my wheelchair. And so he's prescribed me physical therapy, and we'll see if I can get standing again because I can stand. It's just, it's harder with my caregivers. Some of them are shorter, and it's not always convenient. And anyway, we'll see where that goes, and otherwise, we'll see the GI doctor later this month. It's the same guy I saw in 2004, and he specializes in genetic myopathies, is what they think I have in my intestines, which is not good because no surgeries for me. He said that I could do a colonoscopy, but they'd have to do special things for me. So I just want to let you guys know that between my breathing and my abdomen, those can be pretty life-threatening conditions. But I'm optimistic. I mean, I'm feeling the benefits of the less stress. But even if that's not the case, I'm in a lot of pain, so I still fighting for a cause, still want to be a voice for the vulnerable adults, getting closer to that, still speaking with my lawyers about that. So besides that, I know it's kind of a long video, but that's what's going on with me. I don't have to deal with, medication injections or anything like the Tysabri stuff, but just have other issues, and kind of wanted to give you guys an update. Besides that, hope everybody has a happy Valentine's Day next week. Bye.